Israel on the verge of a health crisis? Well, this may sound shocking, but Israel has taken over the United States and now has the most opioid users per capita in the world. A report by the Top Center for Social Policy Studies in Israel is now warning that the country is on the verge of an opioid epidemic because of just how common prescriptions for these potent and addictive drugs are. Now, just some background here. Opioids make up a broad group of pain-relieving drugs. They include morphine and fentanyl. And the problem is that they can be extremely addictive because of the pleasure that patients may feel when taking them. Now, over the course of the last 10 years, drug companies have begun to heavily market opioids here in Israel. And joining us now to break down what this means for the future of the Israeli healthcare system is Oren Miron. He's a doctoral researcher at Ben-Gurion University who helped take part and run this study. So, all right, so many questions here. We know that in the late 1990s, when the U.S. and other countries started, to really struggle with opioid epidemics, Israel was in a totally different place. It wasn't a part of this issue. How has Israel caught up in such a short time, and why is abuse of these drugs so prevalent in this country?
So Israel replaced its safe prescribing habits with the U.S. dangerous prescribing habits. So a soldier that breaks his arm used to only get non-opioid alternative or get weak opioids, but now it's getting strong opioids, including fentanyl, which is 50 times stronger than heroin. And as we have those habits for years and years, we see more and more addicts, more and more abuse, and more overdoses. And to compound it all, we have a very big problem in detecting the addiction and overdoses because of our testing kits. So this is an example of a testing kit that doesn't have fentanyl. So if a child, you check for addiction or an overdose, you may think it doesn't have a fentanyl problem just because it doesn't have that chemical that detects fentanyl. And that's one of our main suggestions to try to curb this problem and prevent an epidemic similar to the U.S.
Right, is to check or to redo the process in which we're checking for these overdoses.
Exactly.
So, I'd like to kind of talk about why we've seen that change. Why all of a sudden we seeing Israeli doctors prescribe more opioids, especially in a public healthcare system, which you would think means that, there's less of a financial incentive for doctors to be prescribing these drugs, because that was kind of one of the foundational issues that we saw in the U.S. If a company says, hey, we're going to pay you more to give this out more, there's your incentive. But that's not necessarily the case here, right?
Yes, so the problem is that we take the prescribing habits from the U.S., even though we don't have the incentives to do it. And so we see not only Israel, but also Canada and Scotland, which are also public healthcare systems, they have higher death rates from opioids than the U.S. at certain years. So basically, it's not just for private healthcare systems, and we need to be very careful and learn from the U.S. They had a horrible problem when they finally did get around to it, and the government did step in and stopped the prescriptions with one blow. It actually caused, and there weren't enough treatment for rehabilitation, it caused a lot of addicts to go to the street drugs, and that brought the huge amounts of deaths. Our main focus is now providing more treatments for rehabilitation, especially in the periphery and the south.
Right. Okay. So, another thing that I just want to ask about this before we get to, what needs to change here is the fact that one of the, issues that characterized the opioid epidemic in the United States was the disastrous number of overdoses that we saw. Are we seeing the same amount of overdoses in Israel, or the same rate, you could say, of overdoses, or is that not really the concern here?
We haven't reached it yet, thank God, but we are climbing, and one of the biggest problems is we have a huge underestimation of the problem because, as we said, we don't test for it, and also Israel, because of religious concerns, has one of the lowest autopsy rates in the developed world. So we need to make sure that just for fentanyl, we do give those tests in morgues, in hospitals, in community centers, and then we can understand how big the problem is. And the main thing, the thing that really jumped, tripled, and quadrupled the amount of deaths in the U.S. was when they didn't provide rehabilitation, and all the addicts went to the street drugs. And that's what we need to stop in order to stop ourselves from going into the U.S. level of 80,000, 100,000 deaths per year.
Right. So, you kind of are answering my final question here about what needs to change, basically, to prevent an epidemic here in Israel. Or, we might already be in the middle one, right? What do we need to do to
Yes.
stop it from continuing?
So we need to improve our testings. We need to improve the rehabilitation, especially peripheral in the South. And we also need an integrative national program that also brings in law enforcement, because the biggest problem that happened in the US was when it turned into the illicit use of those drugs. And we need the police to make great efforts in order to prevent these problems, prevent these fentanyl smugglings, and really keep us safe, because this is a whole new level of devastation, caused the US life expectancy to drop for 2 years in a row. This is the most important thing for us to stop in dealing with fentanyl.
And I'm also assuming preventing patients from doctor shopping, right? Going around to different doctors
Definitely.
as well. And if one says no, then because in the public healthcare system you can do that. You can just find another doctor and make the same request, right?
Yes, but we need to make sure that when we stop it, we also have the rehabilitation, because for now, a lot of these patients, they doctor shop or they get too much high of a dosage. But if we stop it all at once, they go into a crise, into withdrawal. And so we need to provide them with gradual decrease and with alternatives such as Suboxone and Methadone, and really help them get lower, because you can't just quit cold turkey from something this strong.
All right. Well, I'd like to thank you so much for joining us. Really fascinating. And your work in kind of, highlighting this issue is just so important for all of us to be aware of.